I'm just concerned. We're losing our family business because of the economic times. My brother's health care for he and his family, and they desperately need it, is going up to over $2,000 a month. I hear lots of patches being put on what's going on. To me, I understood why the single payer people are so upset, because it does seem like I also heard about Obama's public health insurance, and right now I'm dealing with an insurance company, and I know the funny tricks that are going on, so I don't see how the insurance companies are going to be responsible for reforming our health care. I had another concern, but I can't remember because I'm embarrassed. I just think that the little that I know about the public health care option is that so many people would still have a choice. If they want, they could keep what they have, but if people want an affordable health care, it would give them the same choice as somebody who goes through Aetna.
First I want to ask the Attorney General to say something, but then I'm going to ask Ron Williams, who's here from the Aetna, to talk about it as well. Let me say to those who are the Roman advocates of the single payer idea, that this is part of the debate as well. And whether or not it's going to be a part of this, or does it eventually evolve into that, I would just tell those of you here, look, this is not a question about any one group wants trying to put something together that can work. I serve in a body with 100 people. Rosa serves in a body with 435 people. We have an administration. We have healthcare providers, state legislative bodies, city councils, all across the country, people involved, not to mention, obviously, our own people here are worried about how they're going to get coverage and protected in the healthcare system. And trying to forge a plan and a proposal in the end, which meets all of those various and myriad constituencies and interests, is not easy, obviously, as you already heard described. We failed at it for 60 years. This is a point of historical note. My father introduced the National Healthcare Plan at the Democratic Convention in Philadelphia in 1948, 60 years ago, when Harry Truman was being renominated. And for 60 years, various efforts were made. Now, Medicare, 1965, Medicaid made a huge difference for people. But the gaps are enormous in the country. What you're going through, your family, the small business being left out. The small business, 28 million, they can't afford the health care coverage and the cost that are rising all the time. So putting this together, and so those are the advocates of the single payer. I hear you. Rosa hears you. The administration does as well. We don't have necessarily the kind of coalition that's going to support that at this juncture. But I wouldn't, just let me finish. The point is, it's moving in that direction. We need to get a healthcare plan moving in the right direction. If we insist that it's only our way or the highway, we end up exactly where we have for 60 years. And that is sitting back again year after year after year and nothing happens. So, I want you to raise the ideas because I think they're important in a forum like this, and you have, and you did a very good job, by the way. And thanks for coming as far as you did to be here to express your thoughts.